A new study in the Journal of Clinical Psychiatry suggests that adolescents and young adults are being helped by CBD for their anxiety and depression. Let's talk about it. Hey, everybody, it's Dr. David. An interesting thing came across my newsfeed this week. The American Academy of Pediatrics puts out a daily SmartBrief, and this is a briefing that goes out to pretty much all pediatricians if they're members of the Academy of Pediatrics. And you hear about all types of things. It's one of the good ways that I'm able to keep up with everything that's going on in healthcare relative to pediatrics. Now, this particular study I was really happy to see because not always are we getting a lot of information about natural medicine in these pediatric briefs, but I have noticed that over the past several years that there have been more coming out. So I'm really glad to see that natural medicine is getting more mainstream look because of course that's what we're all about here is getting a holistic approach in order to help out the individual. Now, for those who do not know, CBD is a cannabinoid that is naturally found high in hemp based plants, low in more traditional marijuana plants. Both hemp and marijuana are considered cannabis sativa. So the main difference is that hemp it has the main cannabinoid CBD, whereas marijuana main cannabinoid is THC. Okay, so the lead author for the Australian, for this study that's from Australia, his name is Dr. Maximus Berger. Now, in all honesty, I don't think I have any relationship to him whatsoever, but I thought it was kind of cool, and it's always good to hear what a Dr. Berger's talking about, right? Now, this particular study was a 12-week study. They looked at 31 subjects. It was an open label study. So that means it was not a placebo controlled study that everybody knew. Open label means everybody knows what the person is taking. So of course there is the potential for some type of bias there, knowing that they're taking something, and we know that placebo effects can come into effect. So of course treatment effects can go into effect if a person may think that they're going to get better. So that is one of the things that I do want to point out in the study, but not all studies can be done in the perfect way. Now, high doses of CBD were used. They started off at 200 milligrams of CBD a day. As a point of reference, in my adult patients, I start off with 10 milligrams twice a day. And in my young pediatric population, I start off with five twice a day, sometimes three times a day if sleep is also an issue. But then they worked up to 800 milligrams per day. Now, I have never suggested to a patient to take 800 milligrams of CBD. And I did a little calculation for this, and using the product that we use here in our office, which is from Miriam's Hemp, and using their most concentrated product, which is 100 milligrams per milliliter, and using their 2-ounce bottle, which is a bigger bottle that's more cost effective, it would cost about $600 a month in order to maintain the therapy if they were actually using those high doses. So that's, of course, both something to take into consideration, but of course, are those high doses really needed? We don't know. But what they did is they would kind of, if you weren't getting benefit, you'd go up, you'd go up, you'd go up, and then they cut off at 800 milligrams. Now, but here's the interesting thing. After 12 weeks of the CBD treatment, now, and these were of individuals aged 12 to 25, so again, adolescents to young adults, there was an average of 42.6% in reduction of anxiety overall, and 50%, 0.7% reduction in the severity of their anxiety compared to pre-treatment. Now, they used a couple different rating scales in order to figure those two things out. But the other thing is that they also looked at some other symptoms. And one of the things that they looked at, depression, as you probably know, depression and anxiety often run together. And what they found that the depressive symptoms. So when looking at a study, there is something which is called a p-value. And this is the probability that that a study that shows positive is happening due to reality and not just to luck. Okay. And so a p-value that's less than 0.05 is considered a positive study. Now, for depression, the p-value is actually 0.0001. And also they also looked at just overall function as well, and they found that there was a reduction in their number for that was 0.04%. I mean 0.4, which is less than the 0.5. So again, a positive study that both the overall functioning, the as well as how severe that person's depression was, it was beneficial for that as well, even though that was not the primary thing that they were looking to do. Now, the individuals did continue to receive cognitive behavioral therapy, seeing a therapist, working with a therapist throughout. So that was something that was not changed. That was something that was kept constant through, but they would have also been doing it beforehand. Okay, so what is my take on this? Now, first of all, I'm just thrilled to see major journals that are taking these types of treatments seriously. We need more. We need more. We need more. This study was done in Australia. Wouldn't it be great if we actually see American universities, American journals being able to publish this as well? But also because of this, they were using such a higher starting dose as well as a treatment dose. Again, I do wonder, what they would have shown if they would have used my doses. But now I'm recognizing, yes, by all means, I would never start at that type of dose. Again, I mentioned the doses that I would use, but maybe I should be pushing the doses higher in some of my patients who don't get clinical relief, because I usually will cut them off at 50 milligrams per dose and tell them move on if they're not getting any benefit from there. So it's just something that I'm going to push for. Of course, cost is going to be an issue for some people, but it'll be interesting to see if we are actually able to get better results if I do push back past that 50 milligrams 2 to 3 times a day. So I hope you enjoyed this video. If you haven't subscribed, please join, hit the notification button, hit us up on all of our social media platforms, and have a great day. If you like what you've been seeing, please hit the subscribe button.